Welcome, everyone. I'm here today with Lauren, one of the clinicians here at Mayfield Counseling Centers. And today we're going to be talking about eating disorders.
It's time for your Monday Minute.
So, Lauren, I would really love for you to share with us what qualifies as an eating disorder or also maybe disordered eating.
Okay, that's an awesome question. I think it can be kind of confusing to hear those terms, sometimes even interchangeably. Eating disorders are actually diagnoses, and often they're characterized by behaviors. So you'll often notice behaviors like restriction, undereating, maybe overeating, binging, purging, even over-exercise, things like that can kind of show up. Really, a lot of times kind of piecing those apart, like what's actually true diagnosed eating disorder compared to what's disordered eating, is kind of the level of functionality and how much time is spent on those behaviors, how much crossovers. Often, like with true eating disorders, there will be several behaviors that the person is engaging in, versus maybe just like kind of more of an unhealthy relationship with food on the disordered eating side, if that makes sense.
Yeah. So there are these disorders in the diagnostic manual that therapists might use to help diagnose a eating disorder, but there's also this whole other world of, like you said, maybe a bad relationship with food or different behaviors that don't qualify for disorder. There still might be a whole host of behaviors that might indicate that you have a troubled relationship with food or your body or different things like that.
Yeah. And I think sometimes people might be hesitant to reach out for support if they don't think that they qualify. A lot of times we'll hear like, I'm not sick enough to see a therapist or to, kind of address that. And I think even if you feel like there just might be something kind of off with your relationship with food or with your relationship with your body, that it can sometimes be helpful to just process that with somebody who can help kind of piece that apart, pull that apart a little bit, and really just help provide that support. Also, if you're interested in more information about eating disorders and disordered eating, there's actually a video on that on Mayfield Collective if you want to check that out. So,
yeah, absolutely. I think that it's so important that you are given resources to help you understand maybe what's going on with you, but also, like you said, the support and someone who is actually knowledgeable and educated in this area is so key. Because eating disorders carry so much stigma and so much misconceptions because of how we have talked about those subjects, and oftentimes incorrectly. So what would you recommend for people who are thinking maybe I might fall into that category of people who have a bad relationship with food or my body? What would you tell them to look at to kind of know if they should take some steps about reaching out to a therapist or someone who's knowledgeable in this area?
Yeah, that's a great question. I think, honestly, if it's something that you're wondering about, it's probably a good idea to reach out to somebody, especially if it's causing, if it's taking a lot of your mental energy thinking about these things or emotional energy. That's kind of a sign that it might be something worth exploring with somebody. I would definitely recommend reaching out to someone who specializes in eating disorders or disordered eating so that they can really provide those resources and have a little bit more knowledge of, this is definitely a diagnosis, something that we really need to work on, maybe with the help and support of a dietitian who can kind of help guide you and provide that kind of biological resources. And then a therapist who can help address the emotional, mental component and kind of like what's bubbling under the surface of some of those behaviors.
Yeah, so key. And I'm like, it is definitely that twofold piece. You want to take care of your body and make sure it's getting what it needs. But at the same time, a lot of eating disorders are rooted in the mental health. Like you said, what's bubbling beneath the surface. So it's so important that we try, if you are able to, combine those resources so that you're able to actually move forward towards healing and health and having a more positive relationship with food and with your body. Well, thank you so much, Lauren, for coming and giving us a little snapshot on eating disorders and disordered eating and what we should look for if we need to seek out additional help. I hope you all have a great rest of your week. Hope you have a nice, relaxing weekend. And I look forward to seeing you next week, Monday, for our next Monday Minute.